Today we're going to talk about complications of alcoholism, and as you know, nowadays more and more people are drinking alcohol. It's something to be enjoyed, but it has its difficulties. So recently a friend messaged me and say that he got a message from somebody who said that nowadays red wine is good. So I messaged back and said, not really. Any alcohol is bad. So what about complications of alcoholism? First of all, a reminder of what TeraHertz is. It's a radiation that lies between the microwave and the infrared regions. So actually, TeraHertz is another name for far infrared. Infrared has three different classifications. There's near infrared, which is the infrared that we normally have. You go to infrared saunas, or you sit under the sun, not in the noon time, in the morning, you get this near infrared. Then you have mid infrared, which is in between, and far infrared, which is now called TeraHertz. So it is nothing special. It's part of the normal spectrum. What is it used for? Primarily in telecommunications. If you have used a 5G phone, do you?
No, not
You
yet.
have not yet, huh? 5G use microwave. It's actually millihertz. So 6G is terahertz. Yes. So it exceeds microwave, which is 5G. They're ideal for detecting substance. Every molecule has a signature, a fingerprint. And that's where it is. These are radio waves. We hear radio even from the Second World War. And these are the waves, very long waves. And then 4G phones and all that around here. And then microwave and terahertz. So that's where it is. Human vision, you see the visible spectrum is here. Visible light is this narrow strip here. Beyond that is UV light, which you get from sunlight, which is harmful, right? It can cause skin cancers, it can cause you to have cataracts and things like that. And of course X-ray, which is really harmful. So that's why you don't want to have too many X-rays within a certain period. So the breakthrough, it was in the 1990s when people developed techniques for generating and for detecting terahertz waves. The breakthrough was in 2011 when they were able to shine terahertz waves on a painting, and in those days painting were painted over because they can't get too many canvases to paint on. And they were able to detect a painting in 1771. They could even read the artist's name on it. So is that amazing? Now it's used in archaeology, where they can shine the terahertz waves and see exactly what's inside without having to dig and open up. This was particularly important for a space in China, the tomb of this Qing Huang, where there are a lot of artifacts there, right? They dare not open it because they're afraid it will collapse. Yeah, so they're going to use this technique to do it. So before this, there was something called a TeraHertz gap. What is the gap about? The gap is wavelengths that are longer. We studied under electronics. Wavelengths that are shorter, including visible light, we study under light of photonics. So recently, with all the new discoveries with TeraHertz, what did they use to study? They use photonics. You may or may not know, but I like to keep up with technology news. China is using photonics to create what is known as the photonic chips. It's a microchip using photonic techniques. And in the past, they were using electronic techniques to do microchips. Of course, stand to reason, right? The big fight between US and China, if you are aware, focus on Holland, right? a company called ASML. They make machines, they make microchip, and if you remember, the best machines use EVU, extreme UV techniques. That is using light, they're using photonic technology. And if you read out about that, it's quite complicated, but basically they have to shine the light in a very narrow beam at a very specific beam in order to create the microchip.
So that's the semiconductor, semiconductor company.
I don't know. I read about it. I imagine it's very small. It's because it's photonic. It's very small. Of course, it's done in a plate, circular plate.
Oh yeah.
If you see the pictures of it, but that's what China is doing. Very advanced, you know. So the application, because of its continuity with microwave and radio waves, is primarily used for telecommunication. But because it can penetrate things, it's used in military and security application. In China, it's used for agriculture. So I look up on this, and it seems that they are able to look at plants and look at the amount of moisture in plants, and from that they can deduce whether a drought is coming or not. And of course, health sciences is non-ionizing, it's not like UV light, which can cause your cells to mutate and change. So and because it's resonate and at the same frequency as cells, is very much used in this. That's why the Japanese scientists call it the light of life. So where does the healing property of TeraHertz come from? Well, it shares with other infrared heat. And heat can heal. It can push out toxins, it can stimulate a lot of things, it can penetrate. It penetrates better than other infrared, because of its wavelength. So people wonder, is all there is to it? Because we know that near infrared heal primarily because of the heat, right? We feel better. So scientists have taken away the heat, they just shine the TeraHertz without the heat, and they found it still heals. So it's a vibrational energy that heals. And this is very important, because increasingly if you look up on this, you find that various therapy techniques are based on frequency. Some better than others. Increasingly we use frequency to heal, and that is very important. So applications of TeraHertz, there are two, one diagnostic, one therapy. So if you have a detector for TeraHertz and you shine it on your skin or on your tissue, you can actually visualize what is inside. So cancer tissue, for example, because it is absorbed by the tissue, you can actually make out the size of the cancer and actually the margins of it. So on the bone, for example, you can detect that there are 3 layers. All these things are because of TeraHertz. It's also used for therapy, which I'm sure you know by now. It's very powerful applications there. So, why TeraHertz can heal? Well, number one is non-ionizing. It is absorbed by polar compounds. Polar compounds are compounds which are conductors, and the energy is the same as hydrogen bonds. It's very, very weak bonds. So the thing is, it penetrates non-conducting materials, plastic, textile, anything. As long as it doesn't conduct electricity, it will go through. It's absorbed by different tissues differently. And that's very important. And the third one, because of this energy, it can change the shape of molecules. Because water, for example, are bound together by this kind of forces. So if you have TeraHertz to break up these forces, what happens is that the water no longer aggregate together, they slide over one another. So there is a difference between ordinary water and TeraHertz water on the other hand. TeraHertz water is the same as alkaline water. So the important application is that because normal human cells resonate at this frequency, so that's where the activity of human cells are modified by TeraHertz. Secondly, because activity of human cells produce hormones, produce nutrients, and produce a lot of other things. So it regulates your body cells. That's why it can do so much. So one of the most important thing about TeraHertz is that it can have various effects, and this summarizes it. It open up blood vessels, it vibrate water molecules. Inside the cell, it activates so that it increases energy production. It normalizes hyperactive cells, and on DNA, it can unzip and activate. So I'll go through this. Open up blood vessels. So TeraHertz has the ability to open up blood vessels. These are the arterioles. Blood from the heart reaches here. It's under pressure because your heart pumping under pressure, your blood pressure, and therefore water, oxygen, nutrients leave the arteriole, go into the tissue, okay, where the pressure is low, okay, and your tissue can use all the water, the nutrients, and the oxygen. And then when it comes to the vein side, there's no more under pressure, right? So all the waste products, all the carbon dioxide, and everything's go back into the veins. But because it's not under pressure, not all will go back. That's why you find that in the tissue there are drainage channels called lymph vessels. This drain the excess water and the excess whatever that you need to dispose of to go back to the heart to be disposed. So you regulate inflammation. Together with the blood, your blood vessels contains all these white blood cells, which are actually the inflammatory cells. So if you have infection, you have bleeding or whatever, these inflammatory cells will come along to protect you. They're the soldiers of your body. So sometimes these are excessive. So when these are excessive, TeraHertz can calm the inflammation down, regulate it. The other thing is activate normal cell. Inside your cell are tiny organelles called mitochondria. As you can see in this, the mitochondria is a powerhouse of the cell. It can do a lot of things. It can give you energy. This cycle gives you energy in the form of ATP. And let's say you're running, you need to produce a lot of ATP to give you the energy to run. And it synthesizes a lot of things. It translates the instructions from the genes and produce new chemicals for your body and so forth. Okay? And the other thing is also get rid of waste products. Your cell have a certain life, at the most 120 days. At the end of it, those cellular molecules have to be broken up, and when they're broken up, they have proteins that basically give signals like find me and eat me. And so certain white blood cells called phagocytes are able to engulf all these proteins. They are no longer needed, and the cell has kind of disintegrate and consume them and digest them and use them for other purpose. So it's very interesting, isn't it, that your body is able to recycle a lot of the things by destroying things that are no longer needed. So, and the other thing is, besides destroying cells that have passed its normal lifespan, it can also destroy bacteria, viruses, and so forth. It sterilizes them, kill them. And that's how I discovered, because it's COVID, there was a lot of papers that talk about how infrared lasers can be used to treat COVID. Very successfully, there were trials conducted, and this was very helpful because then we have a way to control viruses and bacteria without causing the patient to suffer and then die eventually. The other thing is, it's able to activate DNA. Now this is very important because this is how your body can rejuvenate itself. Your DNA is a zip. There are two strands there, and the two strands are open up for two purposes. The DNA contains the instructions to produce various things that you need. So in order to produce, you need to open up. You have a helicase to open it up, and then you need a reader, a primer to read the instructions and then create a messenger RNA, which then goes out to the mitochondria to produce a particular molecule that you need. It's a very complex process, and so TeraHertz is able to activate this, and it can also multiply. You multiply when you open up, and then you duplicate the RNA using certain enzymes. So one pair of DNA strand, after they duplicate, become two pairs. That's where mutation comes in, because it's never perfect. So we come back to alcoholism. What is the definition of alcoholism? Very simple. Alcoholism is classified as a disease. Remember, it is a disease. And one of the signs of the disease, you crave alcohol. You can't control. And you need to drink greater amounts. And the classic sign is if you stop it, you have withdrawal. So you can't control, you can't stop, and if you stop, you have withdrawal. Very simple. So for any substance, as long as you have this, it is classified as a disease. For example, if you like sugary drinks, you can't control, and you can't stop, and if you stop, you have a withdrawal, then it's a disease.
Coffee also.
Coffee to some extent it is, but you can regulate it. There is a withdrawal. I have seen coffee with caffeine withdrawal. Coffee has some good effects. Coffee beans have very powerful antioxidants. Coffee drinkers live longer. It's true. Yeah, it's true.
But cannot add sugar. Don't add sugar, must drink.
It depends on how much. The regular cup is about, is it 5 or 25? I don't know, you can check out on the internet. Regular cup is about that amount of caffeine. More than 5 cups of coffee a day is considered an addiction. There are definitions. In science, that's what we do. We define things clearly and we measure. See, there's a way of measuring. We'll measure this for you. This are all equivalent. This are all equivalent. And all this are called 1 unit. This is 1 unit, 1 unit, 1 unit, 1 unit. 1 unit is 1 glass of beer, which is about 300 cc. So 1 can. 1 glass of wine, which is about 100 cc, 13-14% alcohol, is also 1 unit. 1 shot of spirits, which is about 30 cc, is also 1 unit. So these are all equivalent. So how many units you can take a day? After a lot of hard work, we determine that as long as you don't exceed 14 units a week or 2 units a day for men, 1 unit a day for women, is okay. Because there's always an alternative. You don't drink. So these are the standards. I will tell you about binge drinking later on. So what are the complications of alcoholism? Alcoholic poisoning, liver disease, alcoholic dementia, pancreatitis, cancer, heart disease, diabetes. It also causes psychiatric symptoms like depression and anxiety. Quite a lot, isn't it? So let's go through one by one in turn. These effects of alcohol in the diagram on the brain, on the esophagus, it causes bleeding. This is usually associated with liver disease, so we'll cover it under liver. In the lungs, breathing difficulties. Pancreas, this is important. Muscular, your weakness, and heart irregular beats, strokes, and high blood pressure. So, but alcohol directly can cause death. Huh? Recently, there's the famous accident in Tampines, right? So it can cause you to have accidents, and you can end up killing people through violence or whatever. You can be poisoned, liver disease, hypertension. Alcohol is the third most preventable cause of death worldwide, everywhere in the world. Doesn't matter east or west, it's the same. But of course, if you drink a little bit, it can be fun. Huh? So poisoning, overdose of alcohol. There's mental confusion, stupor. They can't remain conscious. Sometimes they're sleepy. If they're just sleepy, and as long as the pulse and everything is normal, yeah, they can sleep it off. But they may not be like that. Huh? They could be vomiting, cold, clammy hands, irregular breathing, slow heart rate. They may be having fits. That's when you need to seek for help. People can die. There are heard of cases like that. Why they didn't detect? They thought it's just a hangover, sleeping over. Hangover or not, it's a pulse. If the pulse is irregular, if the breathing is so slow that it's almost about to stop, get help. So what do? When you have all the abnormal signs, get help, keep them away if you can, give water, dehydrate them, prevent choking in case they vomit. And vomit can just come out automatically. They may not be conscious, it just come out. Keep them warm, cover them, and when they come, explain what happened. Very important. So, overdosage with symptoms is an emergency because they can die from it, and we have heard from time to time people have this has happened to people, isn't it? Huh? So, when do we know we are addicted? When we have blackouts, dizziness, shake, very gross tremor, nausea, cravings, sweating. Effect on the body, mental function disturbed, heartbeats, liver disease, your immunity is weakened, blood sugar spikes, and stomach inflammation. Stomach inflammation is one of the causes of bleeding due to alcohol. So, alcoholic liver disease, it causes a spectrum, okay? At the simplest level, it's just a fatty liver. Fatty liver, you don't know. You go for a medical examination and the doctor say, hey, your liver is enlarged. It's fatty liver. That's the first stage. So, if you go binge drinking, you drink more than 2 units of beer, alcohol, or shots. And you drink a lot, you're with friends, happy, so drink after drink after drink, each one challenge another to drink, you're fatty liver. Then second stage, you go to the stage of hepatitis. And if you continue to drink, you go to liver cirrhosis. It's the final stage, end stage also. So, let's talk about it. When you reach hepatitis stage, jaundice may or may not appear, but when you're in the third stage, it definitely appears. Lost appetite, enlarged liver, your body temperature can be cold or very high, your heart rate definitely high, your respiratory rate, your breathing also high, your blood cells count is also abnormal. That's why the minimum thing you should do is to make sure that the person is okay. Take his bowel, make sure it's regular, make sure it's breathing okay. Then you know that it's alright. When these are abnormal, you know something is happening. Okay? So this is a healthy liver, this is unhealthy liver. It's enlarged. You can actually feel it, you know. You put your finger like that, put below on the right side of the, just below the ribs. And as you breathe in and out, you can feel the liver hitting it, touching it. You can actually feel it. So, it's very simple thing to do. And any normal people can feel it. And in fact, if a patient has an enlarged liver and I don't believe it, I say, okay, just put your hand there and breathe in and out. And he can feel the edge of the liver hitting his fingers. You can feel it. So, fatty liver or called steatosis is due to deposits of fat in between the cell. Normal liver cell is like that. Actually, normal liver cell is like a neck. People who have done anything should know. These are the portal vein, and then the cells are like that. And so blood will flow from the artery to the portal vein, pass all the cells where all the exchange takes place. Waste products get into the liver tissue and then drain. The other things then go into the portal vein, go back to the heart. So that's what we call a liver architecture, because to facilitate this exchange, there's a structure there. So this structure is somewhat destroyed by fatty liver. Of course, as I said, after a few days to up to a week or so, it resolves itself and the fat get removed, or it becomes hepatitis, where you have symptoms. So if you stop alcohol, it resolves. If you continue to abuse alcohol, it got into cirrhosis. What's so significant about cirrhosis is because fibrosis, because of the injury, the body lays down fibrous tissue. And this fibrous tissue, as you know, your scar is made up of fibrous tissue. And fibrous tissue after some time become hardened, right? Your scar tissue become hardened. So imagine this fibrous tissue, this scar tissue inside your liver, hardened, rock hard. That's what cirrhosis of the liver is. It's really hard. You see? So, when your normal liver cells are replaced by fibrous tissue, every normal activity is reduced. So, fatty liver, hepatitis, fibrosis, and this is the end stage. Your liver is no longer functioning. Your liver cells cannot produce all the clotting factors and all that. And because there's obstruction, a lot of things happen. So, factors contribute to alcoholic hepatitis, existing liver, obesity, diet, genetics, malnutrition, fatty and alcohol. So end stage, cirrhosis is irreversible. When you have scar tissue on the skin, you can see it, right? It's hard. You can't reverse it. From fatty liver to cirrhosis, it takes 10 years of drinking. My father-in-law died of cancer. But a few years before he died, he began to drink every night. At least 4 units. 2 big bottles, sometimes more. At first we all scolded him. But we didn't know at that time that he has been diagnosed with cancer, nose cancer. Of course he didn't tell anybody. And so maybe that's why he drank himself to death. Very sad. So it takes about 10 years of continuous drinking. Binge drinking causes fatty liver. And if you stop, you recover. The greater the interval between binges, the better off you are. So once in a while you have a happy time, you drink a little bit more, that's fine. Your liver will recover. But if you drink in between binges, because most people will drink alcohol, will drink continuously with binges in between, so the liver never get a chance to repair itself, and that's where problem starts. So when limits are exceeded, it progresses to hepatitis and cirrhosis as well as other organs. Mortality is up to 80% within 5 years. So it's not good. And because your liver tissue has changed into fibrous heart tissue, a lot of things don't go through. Blood don't go through. When blood don't go through, blood accumulate in your gullet, esophagus, as well as other places. That's where you go vomiting. When you accumulate in the gullet, swollen veins in the gullet, what happens? It can burst, and when it bursts, because it's connected with your mouth, it will come out through your mouth. It can go through the other end also. So early symptoms of cirrhosis, tiredness, weakness, weight loss, nausea, bruising. The clotting factors that are produced by the liver don't get produced because of the fibrous tissue, so you bruise easily. Itchy skin, why? Because the waste products don't get through, so it goes on the skin and you feel itchy. Redness and bleeding on the skin or in the esophagus. Late stages, jaundice, gastrointestinal bleeding from your esophagus and from your stomach, abdominal swelling, confusion, drowsiness, dark urine. Now, the dark urine is from the pigments of your blood and elsewhere. Usually is in the liver, is detoxified, pass out through your feces. That's why your feces is yellow to dark brown. That's the pigment. But if your liver is blocked, what happens to the urine? They flow around in the blood and end up in the kidney, and you pass out dark color urine, or coffee color urine, like coffee like that. And your stool, pale stool, very pale, white, like clay like that. And lots of sex drives because the chemicals are all gone. So this is jaundice. You can see it in the eye much clearly. Of course, in the skin. In dark skinned people, you can't see the jaundice. So the only place to go is the eye, right? So that's what the cirrhotic liver looks like. You see the scar, the bleeding on the skin. These are all we call it spider nevi. Because sometimes you look like a spider like that. So you see all this spider angioma. Stomach is distended. The fluid is there because it can't go through the liver back to the heart. That's why they split, jaundice, red palms, confusion. So yellowick is from the accumulated bilirubin. That's the pigments from the blood and elsewhere. Not detoxified in the liver, so that's what happens. So much about the liver. We've talked to the final stages of liver disease. Now we talk about the brain. In the brain, it causes something called Wernicke-Korsakoff syndrome. It's essentially due to a lack of vitamin B1. Why? Because alcoholics, they drink so much alcohol, they lose their appetite, right? And also, alcohol suppresses their appetite. So they don't eat enough, you see? And so there's a lack of timing. They can't balance themselves, the memory, the speech, the judgment are all impaired. There's a risk of injuries, risk of accidents, risk of falls, produce headache, permanent memory loss, fits, long-term effect, the nerve cell die, and that's where you get the dementia. So Wernicke-Korsakoff are two syndromes, one lead to the other. The first syndrome to appear is called Wernicke encephalopathy. It leads to Korsakoff. So Wernicke encephalopathy is a medical emergency. They lose muscle control, they can't balance themselves, they can't see, movement problems, they can't coordinate, the pulse is very high, low blood pressure, the confusion, and treatment. The doctor will set out a drip, they infuse vitamin B1, thiamine. Thiamine is necessary for your energy system to function, and you need thiamine for quite some time because of starvation. So, if caught in time, reversible. You can reverse it, can recover fully. Memory may be a bit impaired, incomplete, can be disabling, but recover. Otherwise, it progresses to the next stage. Next stage is worse. Korsakoff. But before that, when it came to the Korsakoff, weakness, changes and all that. And these are various parts of the brain. This part is particularly important. This what is known as the basal ganglia. This is where balance and all the various functions are. So people use the term wet brain. Wernicke-Korsakoff sounds a bit of a mouthful, right? So instead of saying Wernicke-Korsakoff, wet brain, loss of mental activity, coordination, vision changes, and alcoholic withdrawal. So you notice this thing keep appearing because this is the part that is that kind of enable you to coordinate. This is also the part of the brain that is faulty when you have Parkinson's. So Korsakoff comes after the Wernicke or the wet brain. It produces amnestic syndrome. Amnestic means has to do with amnesia. That means you can't remember things. It's a memory problem. Short-term memory loss. You can't recall even recent events. What's worse, you cannot remember present events for the future. So you may have eaten and then you forget you have eaten and you want to eat some more. I'm sure you heard stories like that, right? The person keep wanting to repeat that. So therefore they repeat words over and over again, and actions as well. And the other thing is they elaborate, they fill, because they can't remember, so there are gaps in the memory. And they fill in the gaps in the memory with new manufactured memory. That means it did happen, they just concocted the memory. So that's what confabulation means. They may be having hallucinations or hearing things. They have difficulty planning, organizing or completing tasks. They lack the motivation to do anything. And 25% may recover after 1 year or so, 50% somewhat. So that's what you see in the brain. You see normal brain tissue is quite full, isn't it? When you have dementia, there are wide open spaces. The ventricles open up. The brain tissue, which is all these things here, also open up. You see spaces in between. That means the brain tissue is gone. So one way to remember this is to remember COACH. COACH is encephalopathy, confusion, weak eye muscles, can't balance, thiamine deficiency. REC, amnesia, concoct stories to fill in the lost memory, and dementia. So Wernicke-Korsakoff can be thought of as a type of dementia caused by chronic alcohol abuse. So you see this quite often in the West. Singapore less likely, we're seeing more of it. Acute pancreatitis. This is rare, but this occurs due to alcohol and gallstones as well as autoimmune disease. So it's inflammation of the pancreas. It's very severe tummy pain. Huh? No, this, I'm talking about this. It's a different thing altogether. Yes. So the pain is so severe that you got to go to hospital. You feel sick, you feel nausea, you feel vomiting, you have diarrhea, fever, and jaundice. If you're having this thing, you won't survive. You go to the hospital, when they take your blood, they find pancreatic enzymes in your blood and urine. And the good thing is there's spontaneous recovery after a week or so. Confusion, swelling, tenderness, rapid pulse, and respiratory failure can take place. So, pancreas is there, near your backbone. And it's associated with the liver and gallbladder. In fact, gallbladder. Can you let me talk? Let me talk. After you can ask question. Okay. It go into the intestines, and a duct from the pancreas take the secretion from the pancreas together from the common bowel duct go into the intestines. And so, if gallbladder has gallstones, the gallstones will come down and get stuck here. Then it will cause the inflammation. That's why it's associated with gallstones. Okay? So, the commonest cause of acute pancreatitis is gallstone followed by alcohol. Okay? And you have these are blood clots on the stomach, around the umbilicus, and on the side. The abdominal pain of acute pancreatitis is a pain that starts here but goes on the side and behind. So, intermittent, chronic, or frequent experience stabbing pain, upper abdominal pain that goes to the back. Nausea, vomiting, fever, rapid pulse. Now it can progress to become chronic, and that's when there's permanent damage to the pancreas. There's scarring the results, and the pancreas lost its function. The pancreas is not only producing gastric juice. If you remember, or you may not know, the pancreas also produces insulin. And so, if the insulin, if the tissue that produces insulin is affected, you end up with diabetes. So 1/3 of people with pancreatitis end up with diabetes. So recurrent episodes of pancreatitis is aggravated by alcohol use and cigarette smoking. So other things about obesity, diabetes, and family history. People with pancreatitis can survive, but there are other complications coming. And one of the important complications is coming up. So acute becomes chronic. Isolated episodes is ongoing disease. Sudden and severe fluctuate. Days and weeks, months and years. Common cause, alcohol, gallstone. Common cause, alcohol, hereditary, other diseases. Okay? So, inflammation can be anywhere here. So, causes are mostly genetic, other than alcohol, other than gallstones. This is a genetic condition, this autoimmune, and so forth. And one of the results is that sometimes a pseudocyst can develop. So the cyst like that, a bump with fluid inside, usually digestive juices. there is hemorrhagic bleeding can take place, and so forth, across gallstones. Alcohol and cancer. Alcohol is almost associated with all cancers, particularly liver, mouth, throat, breast in the female, esophagus, stomach, and bowel. 3.5 drinks a day, risk is increased, double or triple. If you drink 3.5 drinks, it's increased 1.5 times for colorectal and breast cancer. Once you stop drinking, you decrease your cancer risk after several years. Contribution of wife to drinking. If you look at wives of alcoholics, they are categorized as suffering Susan, controlling Catherine, wavering Winifred, punitive Polly. Look at the adjectives. They describe the behavior of the wife. If the wife is punitive, controlling, suffering, or nagging all the time, that's how the wife contributes. And oftentimes that is true. Alcoholism may be related to pancreatic cancer. Chronic pancreatitis is common in pancreatic cancers. Why is there such an uncertainty? Because number one, pancreatitis is very uncommon. Secondly, pancreatic cancers is also very uncommon. So, because it's so uncommon, it's very hard to make a clear association. So, it's highly associated. Hence, you have this uncertainty. So, what about pancreatic cancer? Remember what we say? It is at the back, behind your backbone. It's not easily seen. From the front, it's covered by the intestines. From the back, you see only the backbone and the kidneys. So it's squashed in between. And as a result, when cancer forms in the pancreas, it's very hard to know that there's a cancer there. So by the time it's discovered, it's often stage 4. You never discover pancreatic cancer earlier unless you happen to go for a scan of the abdomen and you pick up, hey, there is a lump in the pancreas. You are lucky if that happens. More often than not, because it is hidden, tucked underneath the liver and the stomach. That's why it's often not seen. So, if there's alcoholism, if there's pancreatitis history, take a look at the pancreas. You may have a cancer there. Now, there are many kinds of cancers. The cancers in the pancreas usually is a ductal cancer. That means it's a cancer from the cells of the duct. It can also be a cancer of the cells that produce insulin. So it's called an insulinoma. Or it also produces a hormone called gastrin, in which case it's called a gastrinoma. So these are rare. This insulinoma and gastrinoma, they tend to grow much more slowly. But this often not so slow, but fast enough that by the time they are detected, they are stage 4 and already spread to other places. So by the time they are detected, the secondary is in the liver, probably in the lungs. Liver, secondary cancer. Primary is here. Back pain, loss of appetite, jaundice, weight loss, nausea, change in the stool. Onset of diabetes, as you said just now. Pancreatitis can give you diabetes, right? So, pancreatic cancer, no symptoms. Until it's very big, and be suspicious if you have abdominal pain, especially to the side and to the back. loss of appetite, weight loss, itch. I explained already. Jaundice with itch because of the pigment that cannot be detox. If the stools are light and floating, dark color urine, new diabetes, diabetes, pain, swelling in the arm due to blood clots. Alcoholism in the heart. This is interesting. It's a very big topic. But alcohol weakens heart muscles. That's definite. It can cause high blood pressure, causing the heart muscles to work very hard and to kind of become thin out. Heart rate is very slow. Disorders of rhythm, chest pain through high blood pressure, abnormal heart rhythm. It can cause secretion of cortisol. Cortisol is secreted under stress, so it will affect a lot of your organs. It affects the nervous system, that will affect the regulated blood pressure, and it causes something called cardiomyopathy. This is a condition where the heart muscles are weakened. It impacts the endothelium, the lining of the heart, and the blood vessels. So these are the things: rapid pulse rate, disorders of rhythm, blood pressure weakening. This is cardiomyopathy. The muscles all gone, so become weakened, enlarges, cause blood clots, and so forth. So negative effects of increased alcohol, high blood pressure, the endothelium, the lining of the cells, the stress, increased platelets, so there will be clots, increase this factor, so this dissolution, the clot dissolving ability is reduced, so more clots appear. So a lot of this, there's a lot of problems that alcohol can cause to the heart. How about diabetes? When you drink too much, your body's sensitivity to insulin is reduced. And anyway, diabetes is a side effect of pancreatitis. When your body processes too much alcohol, it stops processing sugar, and so your glucose level can drop, and that's why sometimes alcoholics end up with low blood sugar. Conversely, it can also lead to high blood glucose level because of insulin insensitivity. So that's why when we treat, we always check the blood sugar level. And of course, it can cause diabetes. Stopping alcohol may not reverse diabetes, but improve diabetic control. So, all these are equivalent. You must know your limit. Things to remember: cautious, monitor blood, manage your medication, be careful, be sure your identification in case you lost consciousness. People can trace where you live, what's your name. 3 ways is linked to diabetes. Large amount make you insensitive to insulin. Remember, diabetes has to do with insulin insensitivity. And diabetes is a result. Alcohol contributes to weight gain, which also leads to diabetes. Sleep. If you stop alcohol for 40 days for those who drink, it reduces anxiety, better sleep, increase energy, increase productivity. Do you know the different stages of sleep? Do you know what's REM sleep, for instance? And slow wave sleep, for instance. Okay, sleep has many stages. There's 1, 2, 3, and 4. Stage 4 is known as short wave sleep. In between normal sleep, there's another type of sleep called REM sleep. REM sleep stands for rapid eye movement. Where if you look at the person, you can see his eye moving very rapidly. REM sleep is associated with dreams. When you're having REM sleep and you wake them up, they report a dream. Now, it's believed REM sleep serves a function. REM sleep allows your body to process the memory it has earlier on and to integrate them with your memory. So you need your REM sleep. You need your REM sleep. Okay? Alcohol reduces your REM sleep. That means you cannot process a memory properly and store them to long-term memory. And then there's a delayed onset of REM sleep. More slow wave sleep. Slow wave sleep is deep sleep. You need a little bit of it, but you need your REM sleep more than your slow wave sleep. REM sleep helps brain process and consolidate new information to store into the long-term memory. Right? So REM sleep also maintains and strengthens the synapses in the brain because it kind of connects up memory together. REM sleep is associated with mental health and stronger immune system. And if you're sleep deprived of REM sleep, it will affect your working memory. So, lack of REM sleep can cause a lot of problems. That's why dreaming is very important. The significance of dreams. So, all this, increased insomnia, altered sleep stages, worsening of sleep, apnea means you stop breathing. Other effects of sleep, increased use of stimulants because you can't keep awake, use of substance abuse, you abuse substances. You take things to keep awake, and then come to bedtime, you can't sleep. You take things to make you sleep. So this is what I call double addiction. Take something to keep you awake, take something to help you sleep. Alcohol intake, self-medication, sleep disorders, and all these things happen. Alcohol use disorder, neurotoxicity, all these things. Can't sleep. Interestingly, a lot of people use beer as an antidepressant, beer or alcohol. In studies in the US, in UK in the past, they find that females have so much depression, and males don't seem to be depressed. Until one person said, let's include alcohol. So when I look at alcohol abuse plus depression, male and female are equal. And then it was later established that people use alcohol as an antidepressant to combat their low mood. Unfortunately, alcohol is a depressant itself, so it actually makes it worse. The sleep quality gets worse. Mental health. Now, it is true that alcohol makes you feel less anxious, more confident, transient, and but as it proceeds, you get anger, depression, and negative feelings, then take over. 1/3 of alcoholics have a mental illness, and the mental illness, mental depression, bipolar disorder, anxiety disorder. On top of it, the ability to maintain balance, speech, and judgment is gone. Fine motor skill is gone. And they have difficulties in memory because there is a problem converting short-term to long-term memory. So, there's blurred vision, they have loss of coordination. So, while people use alcohol as an antidepressant, it creates other problems, and definitely not the answer. So these are all the signs. Can't control or stop. Desire to drink interfere with other things. You cut down on on friends, on hobbies, and so forth. Drink interferes with the work, and you still persist in alcohol in spite of this. So, contributing to alcoholism are genetics, environment, mental health, traumatic experience. This is very important. Traumatic experience lead to a lot of things. And, something I like to talk about one day, because there's a lot of traumatic stress nowadays occurring as a result of the modern lifestyle. Withdrawal, your headache, clammy skin, shakiness, fatigue, appetite loss, difficulty eating. Heavy alcohol use trigger withdrawal, which is called delirium tremens. They get confused, they have hallucinations, they have disturbances, and they need to be hospitalized and be treated. So, as I said before, last time I see very few alcohol withdrawal. Now I'm seeing more, which is a bad sign, really. Stop responding. Doesn't respond. Okay. These are the mental illnesses associated with alcohol use disorders. Unfortunately, alcohol abuse is never alone by itself. It's often associated with other abuses. Thank you. So, cannabis, which is very common, hard drugs, heroin, whatever. Depressive disorders, anxiety disorders. And because people tend to use alcohol as an antidepressant, a lot of people with trauma often end up alcoholics. Sleep disorders, because people use alcohol as a means to help with their sleep. So, when you abstain from alcohol, it will be worse first. It gets worse because of withdrawal, and then it will get better. So any problems associated with alcohol, you must realize that when you stop alcohol, there is often withdrawal symptoms. It will be worse. So they keep on drinking because they feel worse if they stop drinking. They fail to realize that the withdrawal is part of drinking. It's only when they go through the withdrawal, then they get better. And of course, alcoholics don't understand that. All they know is that if they don't drink, I feel worse. I must drink, then I feel better. Not true. But that's the reasoning. So, I have put everything about treatment to the end because it's all one problem. And the one problem is alcohol. If you stop early, everything can be reversed. All the things I talk about in this talk, all the 1 hour, I tell you about all the things, can be back to normal once you stop alcohol. But oftentimes, alcoholics don't stop. And this information perhaps can help you or someone you know, your loved ones, your friends or whatever. TeraHertz, as we said, can reduce inflammation, improve the symptoms, antioxidants, action and improve healing. Certainly, whatever problems you have in alcoholism, you use TeraHertz, you're better off. And it can also improve scar as well as dead tissues. Right? So, if they are not major, they can be reversed. When they are major and too excessive, there's nothing you can do. We know that dementia has shown improvement with TeraHertz. We know that. We know that. The big question is the liver architecture, the structure of the liver is still intact? If it's intact, then yes, it will improve. Otherwise, it may be irreversible. Same with your pancreas. If it produces until it produces diabetes, it may not be irreversible. Same with your cardiomyopathy. Can it be reversed? Can the dead muscles come back to life again? This depends on how long it has progressed. Certainly, very important, stop drinking. So TeraHertz can have all these effects on animal models. Things improve, pathogens reduce, beneficial bacteria improve, diabetes improve, inflammation improve in the brain, in dementia, with TeraHertz, all these abnormal deficits get reduced without it increases. So TeraHertz, there is a beneficial effect. No doubt about it. A lot of experiments have been done. Otherwise, I won't be able to get all these beautiful diagrams. So together with TeraHertz, you need to blow. These are home devices, and you need to blow a lot of time. And some people don't have the time. But TeraHertz is one way. There are other ways. And if you have all the disease, the other cutting edge, which give you the same effect, is there stem cells. Stem cells in principle can repair the damage and regenerate back to normal tissue. I myself can testify, my heart, I have a heart attack exactly about 10 or 11 years ago. 3-4 years after my heart attack, we do a investigation, ultrasound. Very clear there were scar tissue at the base of my heart. And then I was on stem cells for quite some years, 7 years ago. And recently when I went for an investigation of my heart and to see where I stand, the cardiologist said, your heart is normal, like an 18-year-old. That means the scar tissue is gone. So it does have regeneration. And we have evidence. There's a YouTube video that loudly proclaim stem cells can actually do it. And in fact, in Straits Times, last year and sometime previous to that, the news report that doctors in Singapore are using stem cells to cure conditions in the brain such as Parkinson's and dementia with stem cells. So it may not be able to reverse cirrhosis completely because cirrhosis is heart tissue, but it can regenerate liver cells. With hepatitis, stem cells can restore the damage and reverse it. So that is the hope. And if you remember, in the US, about more than 15 years ago, 10 over years ago, President Bush refused to allow stem cell research to carry on, remember? And then Obama reversed it, remember? The Democrats and the Republicans, their politics. But why did they want to consider such legislation? Because stem cell research has been going on for 30 years or more. By that time, the basic research showed that stem cells is effective. So they want to do double-blind studies to prove that stem cells can be used for treatment. And that's what the argument was about. Okay, the complaint was that stem cells require the death of babies in order to get a stem cell. No. Stem cells can be harvested without the death of anybody. In fact, that's the beautiful thing. So, whatever is said about treatment, the important thing is alcohol must be stopped. Alcohol cannot go on because alcohol is an irritant that produces all these things. So, in the brain, stem cell therapy, the liver, can do that, the pancreas, in the heart. My own heart has a scar tissue and repair. So, I am a living proof that this thing is possible. And the thing is, more and more people are able to demonstrate this. So what is the takeaway? Very important. Alcohol is a leading cause of morbidity and mortality. In the US, 5 million emergency visits a year and 178,000 deaths a year. Now, this is serious. You must remember there is no perfectly safe level of alcohol consumption. Even at low levels of consumption, regardless of beverage type, whether it's red wine or spirits or whatever. Alcohol is a carcinogenic cancer of many cancers. And whole body is impacted by alcohol use. Every part of the body is used. Yeah, if you can control yourself, I use it for my anxiety, a little bit of it allows you to function better. By all means, use it. If you can keep to that limit. And I don't drink every day, for that matter. So, the important thing is, are people around you aware of this? Who will tell them? So in a way, this information is useful to you if your friends, your relatives, loved ones who love alcohol and thinks that it is the answer to all the problems. It is not. It will cause more problems. Never see this. Benefits? Lower stress, smaller stroke risk, may ward off dementia in small amounts. 1 month alcohol free, that's all the benefits. This is a far infrared sauna, which is what TeraHertz is. It will do you wonders. I don't know whether such facilities exist in Singapore. I know a few places that offer TeraHertz devices.
Our friend has this. Our friend has this in the house. We got one friend who has this in the house.
Is it?
Something like that.
Where?
In his house.
Oh, in his house?
Wow,
that's interesting. I'm talking about clinics and all that.
Yeah, but they buy the device.
Yeah, you can buy it. You can buy all.
Yeah.
There are a lot of such devices.
Yeah.
Anyway, it tells you, this is the cause, this is the cure. The only advantage are not many. And you got to weigh the risk. So, is it mindful or mindful? Mindful of nonsense, full of problems, full of anger, full of hate. We tend to focus on intention. That's the Chinese way. The Western way, focus on process. If you focus on intention, that's what Qi is all about, Tai Chi and all that thing. And then you're mindful, I mean, you focus your attention on whatever you're doing with a gratitude heart, you achieve things in life. And what should be our intention be? Lifestyle choice. Good health habits, intake fresh food, output exercise, positive outlook, spend time and be connected with people, then live out your purpose. Without purpose, no meaning. So, can be used in all these things, inflammation, pain, blockages, skin, especially skin. Not for use, pregnant, few diseases, congenital, implants can be used. Wounds can be used. Open wound can be used. This about resonance assessment. We can scan your entire body. This is scanning the heart.